I have a 34-year-old patient, Marjorie. She just had a cesarean section. Um, so she has an abdominal incision that is important to look out for. During my morning assessment, I found out that she has been vomiting. She's extremely nauseous, and she's in 6 out of 10 pain. The pain's radiating from her surgical wound. So with this in mind, I wanted to check her medication administration records and the doctor's orders to see if there are any pain meds ordered and any antiemetics. So we have Gravol and we have morphine to give her. They are intramuscular injections, so the first thing I wanted to do was check her INR lab reports. Her INR was appropriate, so I can go ahead and give the injection. Before doing this, I needed to do some patient teaching. I asked Marjorie if she had had Gravol or morphine before. She had tolerated them both well. I informed her of the side effects of both these drugs. So Gravol can actually cause hypotension, and it can cause drowsiness as well. Morphine can depress your respiratory system, and it also can cause hypotension. So in my assessment, I also focused on her blood pressure and her respiratory rate. They were both appropriate as well. Because of the vomiting, I wanted to assess for dehydration. I checked her skin turgor, mucous membranes, and everything. She seemed hydrated. Because she just had a cesarean section in her abdominal wound, getting her to roll on her side to give the medication, the ventricular site, I had some, I wondered about this incision. So I asked the doctor, as long as we splint the wound and we are careful to roll her and she feels safe doing so, it was okay. So we were sure to splint her. The amount of medication into the ventricular site, the maximum is 3 milliliters. The medication administration form with morphine is 50 milligrams per 1 milliliter. We are giving the 50 milligrams, as I'll discuss in a moment. So 1 milliliter is appropriate to go into this site. Because she just had a baby, I also asked her about breastfeeding, as Gravol can actually go into the breast milk. She is not breastfeeding, she is bottle feeding. So we're okay. And now we're going to go over and look at her charting and prepare the medication. Okay, so looking at the doctor's orders, I have Gravol, 25 to 50 milligrams IM every 4 hours for nausea. Her last dose on her chart was last night, so it was over 4 hours, so it's appropriate to administer this amount. The reason we don't give morphine and Gravol together is they don't act together synergistically in the proper way, so we would do them separately. Right now we're just doing Gravol though. Okay, so I have her MAR with me, and I have the Gravol. So before I go ahead and administer the medication, I'm checking and comparing both the MAR and the doctor's orders. They match. I like to look at my drug guide to make sure the dose is appropriate as well. She's an adult, and the dose is appropriate, 50 to 100 milligrams for adults. This medication, the onset is about 15 to 60 minutes, so I would let her know that. She would be feeling the effects in about that amount of time. So now I'm going to prepare the medication. So I withdraw my vial out of Pyxis. I'm looking at the label and the amount. So Gravol, 50 milligrams per 1 milliliter. I like to check the expiry date as well. So we have that out. And her muscle mass was adequate on the ventricular site, so we're going to go ahead and use that site because it is vascular and absorbs medication well. She did have a fair amount of adipose tissue, so I'm going to choose the 1.5 the needle, 21 gauge. So I have that ready. Alright, so I'm just going to alcohol swab the top of my Gravol. And while I'm waiting for that to dry, I'm going to remove my syringe using a sterile technique. Alright. I wouldn't normally use a filter needle to use withdrawal medication out of a vial. So I'm just attaching So I'm drawing back to loosen the top. Alright, so because I'm giving 1 milliliter, or I'm withdrawing 1 milliliter, I'm going to pull back 1 milliliter of air to inject into the vial. So I'm injecting the air into the vial. Getting some bubbles, so I'm just pulling back as fast as I can. I put this into the sharps container. Alright, so I have a bubble here, so I'm going to Alright, so because I have a little more than what I need into the syringe, I'm going to take it out, pointing it downwards. And I should have primed it before I did that, because now I have bubbles again. I still have what I need. So at this time, if I had a label, I would put a label onto my syringe. I would label it Gravol, and I would put how much is in the dose. So it's 50 milligrams per milliliter. Alright. And now I'm going to take my MAR, my alcohol swab, and my pen to the bedside. I would have washed my hands before I did this. And I'm going to wash my hands before I go into the room. Okay. So as I come into the room, I'm going to ask full name and date of birth. Marjorie Lemon, 34, and her date of birth. And then I would ask for any allergies. She said she has a sulfa allergy. I checked before. There is no contraindications to giving this medication with her sulfa allergy. So as I'm doing this, I'm just going to explain everything that I'm doing. As you see, I have a splint here to protect her abdomen. I'm just going to pull back medication, open up the site so I can see it. Alright. So to find the site, I'm going to find the iliac crest. Alright. Here's where I would go. With the alcohol swab, I start at the site I would like to use, and I move outwards when I'm cleaning the area. I'm actually going to leave the swab there so I can point towards the site that I want to inject in. So now I have my medication. It's at 1 milliliter. I'm double checking it again, or triple checking it. This is the third check. At the bedside with my label to make sure it is the proper medication. And I also want to check her RMAD before as well. And that matches up with her MAR here too. Okay, so Marjorie, I'm going to go ahead and get you to wiggle your toes for me here. Alright, so I'm going to do Z tracking. I'm using my hand to pull back the skin. This is best practice for all IM injections now. I'm going to go in at a 90-degree angle with a darting action. Because I have smaller hands, I don't like to rest my hand on the patient. So now I'm going to aspirate to make sure I have not hit a blood vessel. I'm not seeing any blood, so I'm going to go ahead and inject the medication. I'm injecting the medication. All right. And now I'm going to wait 10 seconds, holding the needle into the patient. So I've waited 10 seconds, and now I'm going to remove the syringe. And I'm going to clamp the safety shut. The alcohol swab. Okay, Marjorie, how did that feel? Felt good. Right, so now I'm going to take her gown back down. Make her comfortable again. If she wants to like this, I'd leave her like this, or if she wants to lay back on her back, I would assist her with that if she needed help. Her call bell is in reach. The bed is as low as it goes, and the side rails are up. Call me if you need anything. I would offer her water and everything like that. So your medication should take about 15 minutes to work, and with this in mind, I would come back and do my assessment with my blood pressure and my respiratory rate and everything to make sure there were no adverse effects occurring. Right. So I would sign my MAR at the bedside. All right, and now I'm going to march here, and then I would complete my charting because this was a PRN medication.